Hi Mateo, I'm Charlotte. I'll be your PT today.
Hello.
Tell me about what brings you in.
I just have like pain in my back,
Okay.
and like shoulder blade area.
When did the pain start?
Started about 3 or 4 weeks ago.
Okay. And did it happen with a certain task or all of a sudden?
It hurts when I'm lifting and also sometimes when I'm at work. I work at a computer, like my desk.
Okay. And if you had to describe the pain, is it dull, achy, sharp?
It's pretty sharp, and then there's also some like numbness and tingling also.
Okay, and where do you feel that numbness and tingling?
Like in my hands, like when I wake up.
What part of your hand specifically?
Like these 3 fingers.
Okay. And at the best, from 0 to 10, how would you describe the pain? 0 being no pain at all, 10 you're in the hospital.
Usually like a 0 right now, but then when it's active, like 6, 7.
6 or 7 at
Yeah.
its worst. And you feel that while you're working and at the gym, that's the most painful?
Both of those, yes.
And then you said it's worse in the morning, the pain?
Yeah, when I wake up in the morning, it usually, my hands are a little numb.
Okay. And then what are you unable to do because of your pain?
I mean, the main thing is really lifting, and then I guess it'll hurt a little bit at work as well. But that doesn't really stop me.
Okay. What specific exercises, when you're lifting, do you feel it?
Yeah, any like row movement, like horizontal mainly, like what I just did there, is usually when I'll catch it. And everything else really doesn't bother me much.
Okay, gotcha. All right, Mateo, I'm just gonna observe your posture.
Okay.
So for this, could you take your shoes and your shirt off, please?
Yeah, of course.
Alright. Could you look that way, please?
Yeah.
Alright, so slight forward head posture. And then look at me again. And a slight side bend to the right side. Okay. Sorry, could you look that way? So then just observing for any spasticity, any edema, any warmth, or any redness in the area, which I'm not seeing any of that. Could you sit over here for me? So then just to palpate, see if we can reproduce any of this pain. Just let me know if you have any pain with any of this, okay?
I know.
Could you scoot back a little? Thanks. Any pain there?
No.
No. Any pain here?
No.
Any pain?
No.
Any pain here?
A little bit.
A little pain, okay. Some slight hypertonicity. Any pain? No. Any pain here?
Yeah.
Alright, and then here?
No.
On the left side, any pain?
No.
No, okay. And then any pain here?
No.
Or here?
No.
Any pain here?
No.
Or here?
No.
Okay, so we're gonna do range of motion, and that's the PT testing. So I'm gonna ask you to position yourself in various positions, and I'm gonna apply overpressure afterward. If you have any pain, anything, just let me know, okay?
Yeah, sure.
So can you just look down? Overpressure, you look up towards the ceiling. Good. Come on, straight, then right ear towards right shoulder. Try to push you more down a little bit. Okay?
No, but a little bit of numbness in my hand fingers.
Now left ear, left shoulder. Okay. don't let me push you down anymore. Any pain?
No.
Now can you rotate your head to the right?
Mm-hmm.
Good. I'm just gonna try to rotate you more,
Yeah.
don't let me. Any pain?
Yeah, my right side hurts.
Okay. Can you look towards your left?
Mm-hmm.
Don't let me rotate. Any pain?
No.
Okay. Now can I have you bring your chin towards your throat?
Mm-hmm.
I'm just gonna apply a little pressure. Okay?
Yeah.
Okay, I'm trying to bring your chin out, but just try to keep your head straight, just kind of poke your chin out.
My chin.
Good. Okay.
No.
So now I'm gonna have your arms behind your head, like this. And I want you to kind of go down and look towards the floor. Good. So just kind of tuck your elbows a little more. Okay?
Mm-hmm.
Now same thing, now just look up towards the ceiling. Good. Now you're gonna tuck yourself like this.
Doesn't matter which one.
No.
Not but.
And rotate to the right. Okay?
Mm-hmm.
Now rotate to the left. Now can I have you stand up?
Yeah.
And I want you to slide down towards your right side. Good. Now slide towards the left. Okay.
Yeah.
Now you can see down. Now can you raise your right arm? Now back.
That hurts a little bit. Coming back. Yeah. Yeah, that's fine.
Now out and up. Good. Now like this. Now I'm gonna do that arm. Same thing. Up.
Up.
And back. Now out and up towards the side. And now can you hold the position and go up? And then down. So bend your elbow. Straighten. Palm down. Palm up. On your wrist. Bring your pinky towards your chest. And bring your thumb out. And then you bend your elbow. Straighten it. Palm down. Palm up. Bring your palm towards you. Palm out. Sink towards your chest. And then thumb out. So, I'm going to move you in various positions. Try not to let me move you and let me know if
Yeah.
Okay. Try to rotate your head.
Mm-hmm.
And I'm going to try to bring you out and push you in, okay? Don't let me move. Good. Good. Now try to push you back.
Yeah.
I'm gonna try to push you to the side. Don't mind. Gracias. Have your arm like this.
Yeah.
On the left. Now, your elbow just kind of like this.
Okay.
Don't need to do that.
Okay.
Yes. So do it again. One more time. Push it down, okay?
Okay.
Don't let me put your palm down. Here. And don't let me bring your palm towards me.
Okay.
Don't let me bring your fingers down. Ready? I'm gonna do it again.
Okay.
Just one more time.
Yep.
And then don't let me bring your pinky towards me. Good. Good. Gonna do that one?
Okay, same thing.
Yep, same as
Alright.
that. Don't let me push it up. Good. Down. Good. Put your palm down. Good. And left. Good. Now your wrist. Good. Good. Push it in. Good. Good. Okay, so now we're gonna check your sensation. So I have this little needle here. This is what it feels like. Feel that?
Yep.
Okay. So when you close your eyes, I'm gonna touch various positions. You let me know if you feel it. Okay?
Okay. Yep.
Okay. So you
Should I
close
close?
your eyes?
Yep.
Yep.
Mm-hmm. Just say yeah if I feel it.
Yeah.
Okay. Yes. Mm-hmm. Yeah.
Yeah.
Yeah. Yes.
Yes.
I don't feel anything.
No.
Yeah. Yeah. Mm-hmm. Yeah.
Now we're gonna assess your reflexes. I'm gonna do both arms, see if there's any difference or any reflexes that are diminished or anything.
Okay.
Okay? So can I have your hand on your hip?
Yeah, like this?
Yep.
Okay.
Good. And then arm out. Bring your radialis. Good. And then your bicep.
Mm-hmm.
Good. Good. Now hand on the hip. Okay. Almost there. Bring your radialis. Good. Good. And bicep.
So now we're going to do the Sperling's test. So first I'm going to start with compressing. So let me know if you feel any pain with this.
Yeah, that one hurts a little bit.
That hurts there?
Yeah.
Okay. Bring your head over here. Any pain when I compress here?
No, no.
Okay. And what about when I compress here?
Yeah, that one hurts.
Okay. So the next one I'm going to do is I'm going to do the distraction test. And I just want you to know if you feel like your symptoms kind of go away when I do this, okay?
Yeah. Yeah, that feels good.
Feels better?
Yeah.
All right. So the last thing I want to do is I want to do something we call the upper limb tension test. So just lay down on your back, put your head here for me. All right. And it's your right arm?
Yeah.
Right arm. All right. So we're gonna keep your arm here.
Mm-hmm.
What I'm gonna do is I'm just gonna extend your arm, and you're gonna let me know if the symptoms get any worse. Okay. I'm also gonna be looking to see if you have any type of limitation as well. Okay.
Uh-huh.
Ready? So right there, I feel a little bit of resistance. Do you
Yeah.
feel any type of pain?
Yeah, a little bit.
You do? Okay. All right. So now I just want to assess your quality of movement. So I'm just gonna ask you to turn to your right. Good. Turn to your left. Good. So a little bit of limitation going to the right. Now I'm just gonna have you do that again. So just go. Okay. Go to your left. Good. So a little bit more skin folds on your right side, on your left side than your right. Okay, so we're gonna do the external stave, the cervical spine. But I just want you to let me know how this feels. Okay. All right. Stave. All right. Rotate your head. So how does that feel?
There's no pain. It usually won't hurt.
Okay. Good. And now I'm gonna apply some BMCs. So starting at C2. Okay, rotate your head for me. Any difference?
Not really, no.
Okay. C3, go ahead. Okay, come back. Go again. Okay, come back. Go again. Okay, come back. Come again. Okay, come back. Go ahead. How did that feel?
That one felt good. That was the best.
Okay. Good. External stave. I'm gonna do the external stave with the thoracic spine as well, just to make sure. So I just want you to. I'm just gonna apply a little bit hug and lift here, and then just rotate your head. Okay. And no difference there. So no.
So earlier we found that there was a little bit of limitation when you were turning your head.
Yeah.
So we just want to find out what's limiting you when you're doing that, okay?
Okay, cool.
All right. So first, I'm just getting the assessment of how much you can move. Just gonna turn your head. Okay. Come back. Now I'm gonna elevate. Okay, and turn your head. Good. So you were able to get more that time.
Yeah.
That was it. I'm gonna depress your arm now. Okay. And let me just turn your head. Definitely feels a little bit more stiff that way. Okay.
That's tight.
Okay. Now just give me your arm. Okay. Good. I'm just gonna apply some tension to your hand. Okay. All right. So just come back to the middle, and now turn your head. Good. And then we're gonna put it on slack here. Okay. And you turn your head again. Okay. Yeah. All right. So we were able to find that when we put your nerve on tension, it made your symptoms a lot worse. You weren't able to rotate as much. And then when we relaxed your nerve, you were able to rotate a lot more. Yeah. So we're thinking that maybe the nerve might be causing the issue. Okay. Okay, so earlier when Nico pushed up on the bone in your T-spine, that helped a lot with the rotation. That might be meaning that one of the bones is not moving as much as it should be. So we're just gonna do an assessment to see which bones are moving correctly and which ones may not be moving as much, okay? Yeah. Okay. All right, so can you just turn to the right for me? Very good, and then can you turn to the left? Good. And next, can you just put your hands Like this behind your neck for me. Good. And I'm just gonna bend you down. Okay, and up. And we're gonna bend down again. Okay. So right in this area, these bones are not moving as much as they should open. So I'm just gonna have you lay down just to do a little bit of a further assessment, okay? So can you lay on your stomach for me?
Yeah, of course. Anywhere I should put my arms around.
You're good like that, don't worry. We're just gonna be pushing down in the bone, okay? You let me know.
Yeah.
T1. T2 is definitely a little bit stiff. You feel how this one doesn't really want to move, but this one moves nice and easy?
Yeah.
Okay. Also, when Nico helped, he provided that stabilization force for you. You said that helped with your pain a little bit.
Mm-hmm.
So I just want to get more of a in-depth look about what might be going on with your stability muscles.
Yeah.
Okay, so for this one, you're going to tuck your chin in to your chest, good, and then you're going to lift it up, good, and you're just going to hold it there, okay? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Good, you come down. Good. This time you're gonna do the same thing, except you're gonna move your right arm, okay? Up and down, just like this, all right? Yep.
Okay.
So you're gonna tuck your chin in, lift, good, and then lift up your arm up and down. 1, 2, 3, 4, 5, 6. Good. And then you can see there that he had a little bit of a chin poke at around 6 seconds. So that might be a failure of the deep vocal muscles here in the area, which are normally supposed to stabilize your neck. So that might be an issue of why you might be moving too much and why you might feel those nerve symptoms in your hand whenever you rotate, okay?
Yeah.
So since we had symptoms on the right side, what I'm going to do is I'm going to do a technique where it's going to decrease the inflammation and hopefully reduce some of the symptoms that we're getting on this right side. All right? You okay with me having my hands around your neck?
Yeah, of course.
All right? At any point, if you want me to stop this, let me know, okay? So I just got to find my way to C7. I will side bend you to the right for me. Cool. All right, now I'm at C7. And how does this feel?
Really good.
Feels okay?
Yeah.
Cool. So we'll do this. and then we'll see if that's any better afterwards, all right?
Okay.
All right. All right, Mateo, so earlier we found that we had some deep neck flexor weaknesses. So this is a treatment designed to target those muscles specifically. So what we're going to do now, as we have you positioned here, so we got the blood pressure cuff right on the back side of your head and neck. So what you're gonna do, hold this right there for me. All right, now I'm gonna pump this up to 20 millimeters of mercury. Right there. All right, so now what you're gonna do is do that chin tuck that we talked about before and go just to that first dash right there. Hold that 10 seconds. We'll do that 10 times, then take a break, all right?
Any questions? See you when.
Very good. So right now what we're going to try and do is we're going to try and crack your mid-spine, all right? Hopefully that'll just gain us some more range of motion there. So I first just want to run through any red flags for this treatment. Do you have any history of osteoporosis?
No, I don't.
Any history of cancer?
No.
Any history of spinal fractures at all?
No.
No? Okay, cool. So what I'll have you do now is give yourself as big a hug as you can. All right, you can actually bend your legs up for me too. Yep. I'm just gonna roll you off to me. All right, don't worry, you're not gonna fall off. I got you. So, get that going. Now what I'll do is I'm gonna lift you up. All right. Come on up. Good. So give me a couple deep breaths. Any pain with this pressure at all right now?
No.
Couple deep breaths, all right. At a certain point, I'm going to give you a little thrust. You okay with that?
Yep.
All right, cool. How'd that feel? Got a couple cracks there?
Yeah, that was good.
All right, cool. Come on up.
All right.
Feeling okay?
Yeah, I feel good.
Lovely.